Hi everybody and welcome to Bare Bones, Chiropractic Exposed, where we delve deep into the world of chiropractic and your body. This is episode 4. Today, real life patient riddles solved. Thank you for joining me. Today, I'll be talking about riddles. What are they? A riddle is a question or statement which needs to be solved by using your inquiring mind. Most are solved by a common and most logical answer. Like these examples. Imagine you're in a dark room. How would you get out? Stop imagining. Okay, how about this one? If an elephant in Africa is called Lala and an elephant in Asia is called Lulu, what do you call an elephant in Antarctica? Lost. Okay, every day we're faced with riddles, puzzles, and enigmas. Sometimes we do them for fun at a dinner party. However, for a lot of you, it forms a key part of your daily work life, and I am certainly no exception. Every patient presents me with a problem to solve. Sometimes these problems are relatively straightforward, but occasionally I really do get some head scratches. I'm going to share with you a couple of patient riddles that required quite a logical mind to solve. So let's talk about the first case. I looked after a lady in her late 40s. She is a work-from-home entrepreneurial professional. She's quite active. She's got quite the busy family lifestyle. She also boxes and attends the gym regularly. Now, she came to me because she was getting neck pain and upper back joint aches and spasms. And this was seen to be related to a lot of just tiredness and the work stress that she was experiencing. Moving her neck in certain directions did make the pain get worse, and this was becoming a almost daily experience. Now, what she felt progressed from the neck to the shoulder area, and it started affecting her right upper arm. Now, she didn't have pins and needles, she didn't feel numb, and she had all her usual power in the whole of the right arm. Now, when treating her chiropractically, she did well, she responded positively, and she was very good with doing all the exercises that were given to her and following the treatment protocol. Now, when I was examining her on one occasion, I noted that her sports bra straps that she was wearing that day were pressing quite firmly and deeply into the shoulder area, quite near her neck. And when I asked the patient how often she wore this type of support garment, I was told that it was actually almost daily. I suggested that the amount of pressure that was pushing into that shoulder just near the neck could be responsible for pulling on her blood vessels and also causing a bit of traction or pull on the nerve. And that could potentially cause the symptoms that she had been finding were worsening over time. So the suggestion was that she would change the type of support wear or bra that she was wearing. And since that time, she's actually found that her symptoms have almost resolved, and she's getting a lot more comfort and focus in dealing with her day-to-day lifestyle. So the answer to that riddle, change the sports bra. Now I'm going to talk to you about a gentleman that came to me when I was working in a clinic in London. This gentleman was an executive in his 40s. He came to us with an increasingly frequent occurrence of dizziness and occasional headaches. Being a city worker, this man worked in quite a stressful sort of position in his company, and the company culture dictated that he had to wear a suit, a collared shirt, and a tie. As the man progressed in his career and his stress levels and responsibility levels increased, he stopped getting as much free time and personal time to look after himself as he would have enjoyed previously. With that change in work-life balance, he didn't exercise consistently. He had a diet that was increasingly of poor nutritional value. And when I challenged the man on this, he said that he actually did have more weight being put on his body over time. Now, what was interesting as well during our discussions with this patient was that the episodes of dizziness and headaches seemed to occur mainly during the working week, which was Monday to Friday for him. His medical investigations looked at bloods, it looked at blood pressure, heart, lung, kidney function. His nervous system was examined as well. The MRI showed nothing untoward in his brain. When I asked him about any potential trauma, like did he play contact sports on the weekend where he might have hurt himself, the man said no, he didn't. One thing that I was worried about is that maybe he had plaque in his arteries, which might have affected blood flow to the brain. But again, the imaging showed nothing significant. Now, can any of you guess what was going on? Well, if anyone thought that perhaps his increasing weight might have something to do with it, then you're kind of right. The gentleman didn't really think too much about changing his clothes other than making sure he had a clean shirt and a nice suit. But his shirt was the same size that it had always been. So therefore, over time, as he gained weight, the shirt collar had become progressively tighter and it was gently choking his blood vessels, impeding flow to his brain. So the gentleman was advised to either get a grip on his lifestyle and eat better and exercise more, or simply buy bigger shirts. So as you can see, clinical conundrums are fairly routine for me. To stay on top of my game, I read widely, I discuss cases with colleagues when necessary, and I keep educating myself because no two patients are ever alike, and sometimes an issue can really just be hiding in plain sight. If you have any questions about today's topic, please get in touch, and as always, have a cracker of a day.